We are going to discuss the examination review checklist, which includes the examinations to be done if you are having the dealing with the long case in the pediatric ward. Then after taking the history, you will perform the examination, and in which first of all you will take the vital signs, which is temperature, pulse rate, respiratory rate, blood pressure, and the cuff should cover the two-thirds of the upper arm. After vital signs, we will take the parameters, which are specific in the pediatric ward, which is height, weight, head circumference. Sometimes we also take the arm circumference, mid-arm circumference. Then we will observe the general appearance of the child. We will check, does the child appear well or ill. Then we will check the state of the hydration, nutrition, and circulation. Then we will check the consciousness, gait, posture, and coordination of the child. Then we will check the nature of the cry and degree of activity if the child is newborn or infant. Then we will check the faces and facial expression. Coming towards the skin, we will observe the color of the skin, and we will check the color for the cyanosis, jaundice, pallor, erythema, and pigmentation. We will check the skin lesions. Hydration and edema signs will be apparent on the skin. Hemorrhagic manifestations and hair distribution and character and desquamation will be checked on the skin. Coming towards the lymph nodes, cervical, axillary, and inguinal lymph nodes are checked, and during the examination, the location, size, sensitivity, tender or not, mobility, consistency, and overlying skin of the lymph nodes is checked. And one should routinely attempt to palpate the suboccipital, preauricular, anterior cervical, posterior cervical, submaxillary, sublingual, axillary, epitrochlear, and inguinal lymph nodes. In the head, size and shape of the head is checked, and then circumference is measured and look in which we will look for the asymmetry. And then we can check the cephalhematoma or caput, frontal bossing or craniotapes. Then we will check the fontanelle, and we will measure the size, tension, number, abnormally late or early closure, and sutures. We can check the dilated veins on the head. Then we can check the scalp hair, and we can look for the texture distribution. Then we can perform the transillumination test if is there any swelling on the head. Then coming towards the face, dysmorphic facial features can be observed. Signs of the facial nerve palsy may be observed on the face. Tenderness over the sinuses may be elicited. Parotid swelling and sinus tenderness has to be checked. Coming towards the eyes, photophobia, visual acuity, muscular control, and nystagmus are checked in the eyes. And Mongolian slant, brush field spots, and epicanthic folds are checked, which make the diagnosis of the Down syndrome. Then we can see the lacrimation, discharge, and redness in the eyes. Exophthalmos or anophthalmos can be checked. Pupillary size, shape, reaction to the light, and accommodation can be checked. Then corneal opacities and cataracts can be checked in the eyes. Fundi and visual fields in older children, fundi and visual fields are also checked. These cannot be checked in the infants and newborns. In the nose, we can check the shape, mucosa, patency, discharge or bleeding in the nose. We can check the pressure. We can apply the pressure over sinuses and see for the discharge or tenderness there. And then we can see the flaring of the nostrils, which may indicate the difficulty in breathing, such as in the asthma or any lung pathology. In the mouth, we first of all we will observe the lips, and we can check the thinness, downturning, fissures, color of the lips and the cleft, if any present. Then we will see the teeth. We will check the number, position, caries, mottling, discoloration, notching or malocclusion or malalignment of the teeth. Then we can check the mucosa, and we will see the color, redness of the strengthened duct. Then enanthems, bones, nodules or abstinence pearls. In the gum, we can palpate tongue. We can check the gums, palate, tongue, uvula, mouth breathing, and geographic tongue, which is usually normal. In the throat, we can see the tonsils. We can check the size, inflammation, exudates, crypts, inflammation of the anterior pillars. We will see the mucosa, hypertrophic lymphoid tissue, postnasal drip, and epiglottis. We can check the voice. There may be the hoarseness, stridor, grunting. We can check the type of the cry and speech of the child. Then we will check the number and condition of the teeth. It should be recorded. A child should have 20 teeth by the age of the 2 years. Coming towards the ears, we will see the pinnas, and we will check the position and size and the canals. We will check the tympanic membranes. We will see the landmarks of the tympanic membrane, mobility. Any perforation, inflammation or discharge present may be noted. Mastoid tenderness and swelling can be checked, and hearing screening is to be performed. In the neck, we will see the position of the neck, which may be disturbed in the torticollis or opisthotonus, and due to which there may be the inability to support the head or mobility. Disturbances in thyroid, we can check the size, contour, bruit, isthmus, nodules, and tenderness of the thyroid. Lymph nodes and JVP in the neck can be checked, and we will also check the position of the trachea, and sternocleidomastoid muscle is to be checked for the swelling, shortening, or webbing of the neck. In the respiratory system, we will see the shape and symmetry of the chest, veins, retractions, pulsations, beading, Harrison's groove, flaring of the ribs, pigeon breast, funnel shaped chest, or position of the nipples and size of the nipples, breasts, length of the sternum, intercostals and subcostal retractions, which all indicates, each individual indicates towards the specific diagnosis. Then we will check the type of the breathing, dyspnea, prolongation of the expiration and expansion. Then we will check the fremitus, flatness or dullness to the percussion. Then we will check the resonance, breath and voice sounds, rails and wheezings. Then coming towards the cardiovascular system, we will check the BP, JVP and pulses, which included in the general physical examination of the cardiovascular system. And for specific for specific examination, we will see the precordial bulging, pulsation of the vessels, thrills, size, shape of the precordium, and auscultation, in which we will check the rate, rhythm, force, quality of the sounds and intensity. Then we will check the location and intensity of the apex beat. Then we will check for the murmurs. We will check the location, position in the cycle, intensity, pitch, effect of the change of the position, transmission, and effect of the exercise. All these parameters has to be checked in the murmurs. In the abdomen, we will check the size and contour, visible peristalsis, respiratory movements, and veins. In veins, we will check the distension and direction of the flow, umbilicus, its size and shape, hernias. For localization of the hernia, we will check the hernial orifices and scar mark. Tenderness and rebound, tenderness and rigidity is to be checked in the abdomen. Then we will check the fluid thrill and shifting dullness if the abdomen is distended and we are suspecting the ascites. Then we will see the palpable organs or masses, and if they are present, then we will check the size, shape, position and mobility of that mass, and we will at the end we will auscultate for the bowel sounds. In neurological examination, first of all we will check the cerebral function, in which we will check the general behavior of the child, level of the consciousness, intelligence, emotional status, memory, orientation, recognition of the visual object, speech, ability to write, performance of the skilled motor acts. All these are included in the cerebral function. Then we will check the cranial nerves, Then we will check the cerebellar function, for which we will perform the finger to nose test, finger to the examiner's finger, rapidly alternating pronation and supination of the hands, ability to run heel down over the other shin and to make a requested motion with the foot, ability to stand with the eyes closed and walk, heel to toe walk, tremor, ataxia, posture, arm swing when walking, nystagmus, abnormalities of the muscles, tone or speech. All these, if any of these is abnormal, then it indicates the cerebellar dysfunction. Then we will check the motor system, in which we will check the muscle size, consistency and tone, muscle contours and outlines, muscle strength, myotonic contractions, slow relaxation, symmetry or posture, fasciculations, if any present, tremor, resistance to passive movements and involuntary movements. Then we will check the sensory system, for which we will check the hearing, vision, light touch, pain, position and vibration. Reflexes are to be checked at the end, which could be the deep reflexes, which are the biceps, brachioradialis, triceps, patellar, Achilles and clonus. And superficial reflexes includes abdominal, cremasteric, plantar and gluteal reflexes. In the musculoskeletal system, generally we will see the deformity, hemihypertrophy, bow legs, which is common in infancy, non-eeks, common after age of the 2 years of age, and paralysis, edema, coldness, posture, gait, stance and asymmetry, if any present. Then we will check the joints for swelling, redness, pain, limitation of the movement, tenderness, motion, rheumatic nodules, carrying angle of the elbows and tibial torsion. Hands and feet are checked for the extra digits, clubbing, simian clines, curvature of the little finger, deformity of the nails, splinter hemorrhages, flat feet. Feet commonly appear flat during the first 2 years. Abnormalities of the feet, dermatoglyphics, width of the thumbs and big toes, syndactyly, length of the various segments and dimpling of the dorsa. Any of these may, if present, indicate the disorder of the musculoskeletal system. Then we will check the spine and the back posture. We will check the curvatures, rigidity, webbed neck, spina bifida, pilonidal dimple or cyst, tuft of the hair, mobility, Mongolian spots, tenderness over the spine, pelvis or the kidneys. Then if the patient is male, then we will check the male genitalia. We will check the circumcision, meatal opening, hypospadias and phimosis, adherent foreskin. Then we will check the these are to be all of these are checked on the penis. And then for the testes we will measure their size. We will check the size and we will palpate them for the cryptorchidism. Then we will check the scrotum and see the examine for the hydrocele, hernia and pubertal changes. Then if the patient is female, then we will look for the vagina, which may be imperforate, in any discharge or adherence may be present. And then we will see the hypertrophy of the clitoris, pubertal changes. Then for the rectum and anus, we will see the irritation, fissures, prolapse or imperforate anus. Then we will perform the rectal examination, and it should be performed with the little finger and it should be inserted slowly. Then check the note the muscles tone, character of the stool, any mass present or tenderness and the sensation. This will cover the whole of the examination, systemic examination of the all the systems of the pediatric patient.